10 to 15% of patients with mild cognitive impairment will develop full-blown dementia within a year of being diagnosed, and these individuals have been found to have low blood levels of EPA and DHA. In the Framingham Heart Study, which followed 899 men and women free of dementia for over 9 years, subjects whose DHA levels were the highest had a nearly 40% lower risk of developing dementia compared to subjects with the lowest levels. In a double-blind randomized controlled trial, patients with a very mild degree of cognitive dysfunction had a slower cognitive decline compared to subjects on the placebo when supplemented with DHA 1.7 grams per day and EPA 0.6 grams per day for 6 months. When those who started off in the placebo group were switched over to the omega-3 supplement, they also showed a slowing in cognitive decline, but unfortunately those with more advanced cognitive decline and Alzheimer's disease did not show benefit from the omega-3s. So maybe there's a window of opportunity during which cognitive function and neuronal health are intact enough that they can be impacted positively by a greater supply of DHA and EPA. There may be a threshold or a point of no return after which damage is too severe and long-standing for the fats to make much difference. Bottom line, start supplementing with marine omega-3s earlier rather than later to protect against cognitive function. DHA and EPA are important for reducing your risk of and treating both dementia and cognitive impairment without dementia. A meta-analysis of double-blind placebo-controlled trials found that in those with cognitive impairment but without dementia, DHA and EPA supplementation led to improvements in immediate recall, attention, and processing speed. No benefit was found in those who had Alzheimer's disease, which again suggests that there might be a threshold after which interventions that are promising in those with milder impairment are no longer effective. In one study of 39 Alzheimer's patients compared to placebo and compared to omega-3s alone, a combination of DHA and EPA and alpha lipoic acid resulted in a slower decline in overall cognition and performance of activities of daily living, as measured by a commonly used assessment tool, the Mini Mental State Examination, MMSE. Considering the role of insulin resistance and impaired glucose metabolism in your brain as major factors in Alzheimer's disease, it makes sense that DHA and EPA together with ALA showed benefit compared to the placebo and even compared to omega-3s on their own. By targeting the glucose and insulin problem as well as the fatty acid status that may be contributing to impaired cognition, this combination is a 1-2 punch striking Alzheimer's at the cellular energy level. To the extent that Alzheimer's disease really is brain insulin resistance or diabetes of the brain, then it's not too far off from type 2 diabetes, and that protecting yourself against this dreaded illness to the extent that any of us can protect ourselves starts with getting the refined carbs out of your diet. But equally important is getting the bad fats out of your diet and getting the good ones in. Below is a summary of the effects fats can have on your brain health. Negative effects of DHA and EPA deficiency in your brain. Impaired cell membrane function, decreased energy generation in neurons, increased levels of inflammatory compounds, decreased phosphatidylserine content, decreased dopamine levels and dopamine receptor activity, decreased blood flow to your brain, reduced availability of growth factors to support healthy neurons, decreased amino acid delivery across your blood-brain barrier. Amino acids are the building blocks for serotonin, dopamine, and other neurotransmitters. Conditions that may benefit from DHA and EPA: Alzheimer's disease, attention deficit hyperactivity disorder, autism, depression, borderline personality disorder, mood instability and impulsive aggression, schizophrenia, hostility, anxiety, bipolar disorder, seasonal affective disorder. Oxidation of omega-6 fat drives neurodegeneration. We've spent a fair amount of time focusing on the importance of omega-3 fats and what can happen if you don't have enough of them in your diet. Now let's dig a little deeper into the detrimental effects of excessive omega-6. Remember, vegetable oils, which are the predominant sources of omega-6 in the Western diet, are the fats government medical nutrition authorities specifically advise you to consume after they erroneously determined saturated fats were to blame for every health problem under the sun. So if you've been trying to do the right thing by following this advice, let's definitively set the record straight. As we've discussed, fatty acids, all kinds, including saturated, monounsaturated, and polyunsaturated, are primary elements in all your cell membranes. Your cell membranes are like security guards defending the perimeter of each and every cell. They let in good things like vitamins and minerals and keep out bad things like toxins and waste products. If your cell membranes are going to do their job correctly, they must be built correctly, which means they have to have a healthy makeup of fats. These fats have to be intact and undamaged. You wouldn't try to build a log cabin with rotting wood. There are a wide variety of factors that contribute to oxidation or damage of these fragile fats. Microorganisms, bacteria and other infectious agents, air pollution, smoking, poor diet, and other insults can damage the fats in your cell membranes. Recall from earlier that the chemical structure of a fat determines how susceptible it is to oxidation. The more double bonds a fat has, the more easily it's oxidized. That is why saturated fats which have no double bonds are the most stable, and polyunsaturated fats which have 2 or more double bonds are the most easily damaged. This oxidation of structural fats is thought to contribute to Parkinson's disease, Alzheimer's disease, schizophrenia, atherosclerosis, inflammation, and much more. These oxidized fats can wreak havoc with your health if they get incorporated into your cell membranes. If this seems like the kind of stuff that you put to sleep in high school biology or college biochem class, perk up because this is vital to understand. If your cell membranes aren't built properly, then biological molecules that are designed to be embedded in or anchored to these membranes aren't going to work properly either. What are these biological molecules? For starters, there are insulin receptors, glucose transporters, thyroid hormone receptors, LDL receptors, and receptors and transporters for all kinds of hormones, enzymes, nutrients, and other compounds that, taken as a whole, keep you alive and functioning well. Don't underestimate the importance of something as seemingly mundane and meaningless as your cell membranes. When you realize that just about everything that happens inside you occurs because each individual cell, be it a liver cell, a muscle cell, a neuron, a pancreatic cell, does what it's designed to do, you gain an appreciation for what an amazing orchestra your body is, with each one of your trillions of cells playing its part, but also blending in seamlessly with all the others. Your membranes are anything but mundane and meaningless. Health begins at the cellular level, and if your cell membranes are unhealthy, then quite simply you won't be healthy. When fats are oxidized in your cells, it can set off a chain reaction that causes other biological molecules to become damaged as well, including DNA and proteins. Alzheimer's disease, Parkinson's disease, and other neurological and neurodegenerative disorders have among their hallmarks the buildup of abnormal and malfunctioning proteins. These dysfunctional proteins might not be the primary causes of these conditions, but as they accumulate and reach toxic levels inside and outside cells, they certainly worsen the process. Adding insult to cellular injury, the destructive chain reaction of oxidation and damage doesn't stay localized to just one cell. Oh no, that would be too easy. Most cells are close enough to each other that the molecules that cause oxidation, free radicals, can jump from one cell to another and another, on and on, spreading like dominoes until they reach an area that has enough antioxidants to neutralize them. Since cell membranes, especially the ones in your brain and central nervous system, are so rich with polyunsaturated fats, your body seems to interpret the oxidation of these fats as a signal that damage is occurring, and to mount a response to repair the cellular damage. Damaged fats are like the alarm going off at a fire station, telling the firefighters to put on their gear and run to the truck. DJ seems to be the canary in the coal mine in terms of sounding the oxidation alarm. DHA has 6 double bonds, so it's extremely fragile and highly susceptible to oxidation. DHA stands for docosahexaenic acid, with hex meaning 6, like a hexagon. If a cell has been so highly damaged that it's safer for it to sacrifice itself rather than infect nearby cells, it commits cellular suicide, a process called apoptosis. But if a cell membrane doesn't have enough DHA in it, the warning bells might never go off, leaving this damaged cell to replicate and spread. Damaged cells replicating and spreading, if that sounds like cancer, now you understand how important adequate DHA is to health, from the very smallest part of you on up to your life as a whole. Mitochondrial dysfunction. If you follow health and nutrition news, or if you read Dr. Mercola's book, Fat for Fuel, you're probably familiar with mitochondrial dysfunction. It is important because some of the conditions we talked about earlier, especially depression and Alzheimer's disease, may be due in part to an energy shortage in certain areas of your brain. And where is energy generated? In your mitochondria. Your mitochondria, singular mitochondrion, are responsible for producing most of your body's ATP, adenosine triphosphate, or the energy currency of your body. A couple of cell types, such as red blood cells and skin cells, don't have mitochondria, but just about every other cell does. In fact, some cells actually have thousands of mitochondria, and if your mitochondria become damaged, then your cells won't have enough energy, which directly contributes to virtually every chronic disease we know of. Most neurodegenerative disorders are associated with mitochondrial dysfunction in neurons. Besides Alzheimer's, this applies to Parkinson's disease, multiple sclerosis, and ALS, aka Lou Gehrig's disease, just to name a few. So what causes mitochondrial dysfunction? The primary thing is the oxidative damage from consuming too many carbs and omega-6, which reduces your ability to burn fat as your primary fuel. But for now, we're going to focus on the damage to fats in your tissues. Just like your cells themselves, all the mitochondria in your cells are surrounded by their own membrane. In fact, your mitochondria have 2 membranes, one on the outside and one forming an inner compartment. And just like your cell membranes, your mitochondrial membranes are composed mostly of fats. If these membranes are built with the wrong fats or become damaged, then your mitochondria become dysfunctional. Oxidized omega-6 linoleic acid and its byproducts have been specifically shown to damage mitochondria and impair healthy cellular function. Things generally go one of 2 ways with mitochondrial dysfunction. When your cells have insufficient energy and they're starved for long enough, they may deteriorate and eventually die, as happens in Alzheimer's, Parkinson's, and ALS. On the other hand, they might refuse to die. We mentioned the process of apoptosis, programmed cell suicide. Your mitochondria control this process, so if they're malfunctioning, they may not be able to properly engage the kill switch, which can result in these damaged cells continuing to replicate unabated and eventually spreading to other parts of your body, wreaking havoc on the whole neighborhood. Allergies and asthma. If you feel like people seem to have more allergies these days than they used to, you're not wrong. If you have a school-aged child, it's hard to ignore how many children and young adults nowadays have life-threatening allergies to certain foods. Allergies are surely nothing new, but they sure seem to affect more people than ever before. The prevalence of allergies and allergic diseases in the industrialized world has decreased so dramatically that it's not reasonable to attribute it to genetics, and the fact that so many children have severe allergies and allergic diseases tells us this isn't a matter of just getting older. Something else is driving this increase. Our physical environment has changed, of course. There's more air pollution, pesticides, toxic ingredients in personal care products and cleaning agents, and any of these, let alone all of them combined, could be causing people's immune systems to be on high alert. But it's also possible the Western diet has something to do with it. The astonishing increase in the omega-6 to 3 ratio during the past 100+ years has paralleled the rise in the prevalence of allergic diseases such as rhino, conjunctivitis, nasal congestion, runny nose, sneezing, postnasal drip, red eyes, or itchy nose or eyes, allergic asthma, and atopic eczema. Many of the inflammatory compounds formed from omega-6 fats have been implicated in allergic asthma and other allergic diseases. A high omega-6 diet keeps susceptible individuals in a hyperallergic state, as opposed to omega-3s, which calm things down. Remember, omega-6s and omega-3s compete for the same biochemical pathways that generate inflammatory and pro-allergenic compounds, or pathways that generate anti-inflammatory and anti-allergenic compounds. The more omega-6 you consume, the more the balance is tipped toward the inflamed, hypervigilant immune state. The combination of cutting back on adulterated omega-6 and increasing omega-3, encouraging formation of resolvins, those compounds formed from omega-3s that resolve inflammation, may help to reduce chronic inflammation and the chronic allergic state. A systematic review and meta-analysis of 15 studies determined that pregnant women may be able to reduce their children's risk for allergic diseases by consuming adequate EPA and DHA. The vast majority of the data show a reduced incidence of allergic diseases in children whose mothers had a higher intake of long-chain omega-3s during pregnancy. Reductions were confirmed for eczema and allergy to egg, and these were also reductions in sensitivity to any food and to any positive skin prick test, wherein they test for multiple allergens for at least the first year of life. Compared with consistent high fish intake during pregnancy, not eating fish at all is associated with a 30% increased risk of asthma in offspring by age 5. It's also correlated with a 46% increased risk of a child being hospitalized for asthma and a 37% increased risk for being prescribed medication for asthma by age 5. A higher maternal dietary omega-6 to 3 ratio in pregnancy is associated with a 37% greater risk for allergic rhinitis in children by 5 years of age. And consuming about 7 ounces or more of fish per week during pregnancy is associated with a 43% reduction in the risk of eczema in offspring. Compared to never eating fish even just once a week during pregnancy was shown to correlate with a 43% reduction in eczema and a 72% in hay fever in children at 5 years old. It's true that you are what you eat, but it's also true that you are what your mother ate. Or if you're a pregnant woman or a woman looking to conceive, your children will be what you eat. Cancer. We mentioned briefly how oxidized and damaged fats in cell and mitochondrial membranes could facilitate a cell's transition from being healthy to turning cancerous. This alone tells you that you want to maintain an optimal omega-6 to 3 ratio, but there's more to this story. Anti-inflammatory metabolites from DHA and EPA may help to reduce the growth and invasiveness of tumors, while linoleic acid can actually reverse the anti-proliferative effects of EPA inhibition of cancer growth, thereby increasing tumor growth. LA has been shown to increase signaling compounds that promote angiogenesis, making new blood vessels to supply cancer cells and tumors, and increase the ability of cancer cells to invade other tissues and metastasize or spread to other parts of the body, while EPA and DHA help to inhibit this. For people already living with cancer, EPA and DHA may be a helpful adjunct to their treatment. One group of researchers found that EPA and DHA supplementation during chemotherapy or radiation helped to prolong survival without negatively impacting the effects of the conventional therapies. Having sufficient DHA and EPA may also boost the efficacy of cancer drugs. For these drugs to work, they have to get into the cancerous cells, and cell membranes that have adequate EPA and DHA are more permeable to these drugs, meaning the drugs get inside the cells more easily. Cancer agents that pass through the cell membrane directly rather than through a special tube or channel within the membrane are taken into cancer cells more readily when the membranes contain more of these unsaturated fats. In fact, some cancer cells that develop a resistance to chemotherapy drugs may pull off this terrible stunt by reducing their membrane fluidity, making it more difficult for the drugs to get inside. According to one researcher, dietary supplementation with certain fats, including EPA, DHA, and GLA, may provide a means of enhancing the response to cancer therapies. Altering the physical and functional properties of tumor cell membranes by enrichment with these fats may increase the response to chemotherapy and radiation, and may to some degree reverse the resistance of cancer cells to certain chemotherapeutic agents. Please note that we're not saying all cancer is caused by inadequate omega-3 and too much omega-6, although it's certainly possible that some cancers are. Cancer is a highly complex, multifactorial illness with numerous contributing factors, many of which researchers probably haven't even identified yet. We're simply showing you that increasing omega-3 and decreasing omega-6 in your diet might give you an edge when it comes to fighting this dreaded disease. With cancer, even a slight edge is surely better than nothing. How's that for a whirlwind tour of the surprising effects of omega-6 and omega-3 fats on health? When you do something as frequently as eating 3 times a day, every day, for most people, it's easy to take the implications for granted, but it's precisely because you do it so frequently that its implications are so profound. As we've discussed, getting your fats right, more good fats, fewer bad fats, can help you stay healthy physically and mentally, body and mind, from the cradle to the grave. In the next chapter, we'll shift focus from the exploding burden of chronic disease to another issue, the increased incidence of which has also paralleled the change in our dietary fats, obesity. Summary: inadequate omega-3 intake can have a profound and negative impact on your mental and physical health. Beginning in utero and into early childhood, brain development in infants require a nutritional intake high in DHA specifically. either through breastfeeding or through supplemented formula. Depression, mood disorders, and various mental health disorders can be caused or worsened by low levels of long-chain omega-3s and can be improved or alleviated with sufficient supplements of DHA and EPA. Cognitive decline, including Alzheimer's disease, is strongly attributed to omega-3 deficiency, and if remedied early enough, the effects can be offset. Oxidized fats, frequently from industrial seed oils, cause cell membranes to malfunction, inhibiting nearly all bodily functions. When these fats oxidize in the membranes of mitochondria, the cell's power plant, energy depletion contributes to degenerative mental diseases. Asthma and allergies are essentially forms of inflammation, and like inflammation, they can be controlled with adequate intake of DHA and EPA. Oxidized fats on cell and mitochondrial membranes can cause a cell to transition from healthy to cancerous, and EPA and DHA supplements can help slow this transition, enhancing response to cancer therapies.